name is Ashley Tracy. I'm in Section 2, and today I'm going to be demonstrating a secondary IV medication administration, better known as a piggyback. So I'm going to start off. Come in the room. Good morning. My name is Ashley. Can I get you to state your name? Or I'm going to be your nurse today. Can I get you to state your name and your date of birth? All right, Mr. Jackson. So your doctor's ordered you some Zosyn, which is an antibacterial piggyback. So you already got some IV run or some medication running. So are you okay with that? Do you have any allergies to Zosyn? Have you ever had Zosyn before? All right, so you have had Zosyn. Do you have any allergies to alcohol or any other medication allergies? No? Alrighty, so I'm going to go over here and I'm going to get my medication ready. I'm going to check my MAR. I'm going to check his labs. All his labs look normal, within normal range. Checked his allergies. So the doctor's ordered 3 milligrams of Zosyn per, and there's 3 milligrams Q6 hours, piggyback, and Zosyn runs over 30 minutes. So there's 3 milligrams per milliliter in here, so I'm going to give him a milliliter, 1 milliliter of Zosyn in a 50 milliliter bag of saline. So Zosyn is an antibacterial. I would go in my drug book and look at the action, the purpose, the recommended dose, the side effects, the contraindications, the nursing interventions, and the infusion rate, which the infusion rate is over 30 minutes. So I'm going to go ahead and do my hand hygiene and get my medication ready. So I'm going to clean the top of my Zosyn, and I'm going to pull out 1 milliliter. I'm going to go ahead and I'm going to clean the top of my IV bag. And now we go into the sharps. I'm going to gently mix my medication. I'm going to put my label on the back, which the label says the client's name, drug, dosage, time, and my initials. I'm going to go ahead and get my secondary line ready. I'm going to go ahead and spike my bag. Go ahead and prime my line, or my drip chamber. Okay, and I'm going to prime my line. Oh, it's primed. And I'm going to clamp it. And I'm going to label my tubing with the date, time, and my initials on it. So I'm going to go ahead and hang this. So I'm going to cut off his primary that's running. So I'm going to clamp it. And that's running at 17 drops per minute. I'm going to go ahead and do this one over. Hang this. This for a second. his primary is lower. I'm going to go ahead and his primary is clamped. And his site, I'm going to check his site. His site, there's no phlebitis, no infiltration. Do you have any pain there? Nope. And the patency is good because the primary has been flowing. The primary is cut off, and the secondary is also cut off. So I'm going to clean my site. I'm going to clean it with some alcohol. I'm going to go in the trash. I'm going to attach it. Okay, and I'm going to get my drip factor, which I figured in earlier, which was 17 drips a minute. So I'm going to go ahead and get that going. Alrighty, so he's got 17 drips a minute going, and his primary is not going right now, so his secondary is running. Let me know, Mr. Jackson, if there's any pain or swelling or redness at the site, okay? I'm going to come back and check on you in about 30 minutes. So let me know. Use your call light if you need me, okay? I'm going to take off my gloves. And all this would go in the sharps and in the trash. All right, Mr. Jackson, how are you feeling? It's been about 30 minutes. You feeling okay? I'm going to look at that site. I don't see any redness, any phlebitis or infiltration. I don't see anything that would look like a medication reaction. Are you feeling okay? Yeah? All right, well, I'm going to go ahead and put my gloves on, and we're going to take you off that secondary, and we're going to put you on back on your primary, okay? Get you some IVs flowing. Alrighty, so I already checked your site. I'm going to clamp you, okay? I'm going to clamp you, make sure you're not running. I'm going to unhook you. And I'm going to put an alligator clamp on that one, if any of the other nurses, so it can stay sterile. I'm going to clean your port, just for good measure. I'm going to get my flow rate back to 17 drops a minute on your primary after I can get back up right. So this is going to go back up. Make sure it's primed. Okay, so I'm going to get it back to 17 drops a minute. So it's at 17 drops a minute. I'm going to unclamp you. Make sure you're not having any kind of medication interaction. You're feeling okay. There's no redness or phlebitis or inflammation at the site. He tolerated the medication well. And now we're going to trash. So I would document, I used my MAR to verify medication at 0300 vancomycin, 500, or not 500, 3 milligrams of Zosyn were given to Mr. Jackson over 30 minutes in a 50 milliliter bag of saline. So he didn't have any inflammation, phlebitis, infiltration. I'm going to check his intake and output. His condition of his IV site looked good, and he got 50 milliliters of fluid. And this is what I would document.